Hi, everyone. Welcome back to the Echo YouTube Concussion series. My name is Connor Massimo, and I'm a physiotherapist in private practice in Peterborough, Ontario. During the Echo series, Banu Sharma and I do this talk together, and he's a concussion researcher at McMaster University, but I'll be doing an abbreviated version of the talk for us today. So learning objectives, most of us have heard that exercise can be helpful in rehabilitation after concussion. Today we want to dive into the research a little bit and give a practical approach. So after we look at research in terms of why exercise can help us with concussion recovery, we'll try to help you in your clinics to effectively prescribe exercise. So exercise and concussion has a lot of research over the past, especially the past decade, but the past 20 years in terms of helping people recover more quickly after concussion. This is found in the most recent concussion consensus statement, as well as in the Ontario Neurotrauma Foundation guidelines, which is where we use a lot of our research to support our studies in echo concussion. Exercise in concussion. When we talk about exercise, today we're talking about sub-maximal aerobic exercise. Now, that doesn't mean that resistance exercise or high intensity interval exercise might not also be helpful, but it's just that most of the research has been done on sub-maximal aerobic exercise, so that's what we'll stick with today. In terms of the effects of exercise, in a review of 23 of the most recent well-done studies, it has been shown that there's a large beneficial effect of exercise after concussion, and that submaximal aerobic exercise is the most well-documented type of exercise to prescribe after concussion. 2 weeks is kind of the gold standard. We want to start exercise within 2 weeks. Even better if, in terms of adherence to exercise programs, if it started within the first week. Typically, we're going to recommend a period of relative rest after concussion, but this period is really only 24 to 48 hours, and a lot of people are still being told to rest far beyond that, even though the research is now showing that early activity is helpful. In terms of the benefit of exercise, meta-analysis has shown that this can decrease in terms of the amount of time following concussion that people have symptoms, can decrease that time by 4.5 days. And that can be really significant if someone gets back to exercise quickly and gets better, a full work week quicker. That can really help them get back to work and get back to meaningful activity. As I mentioned before, we would love to see people return to some level of physical activity within a couple days after injury. And of note on these studies as well is the real significance and importance of decreased screen time, especially for the first 2 days after concussion. In terms of the mechanisms, how does this work? It's not super well understood, but our proposed mechanisms are that after concussion, there's reduced heart rate variability, and exercise, returning to activity, can help to re-regulate that heart rate variability, as well as various other sympathetic and parasympathetic responses that happen after concussion in the brain can become more well regulated by starting exercise again. So in essence, these are changes to the autonomic nervous system that we see following concussion, and we know that exercise is helpful, although we may not know the exact mechanisms yet. In terms of exercise in practice, the gold standard for prescribing exercise safely after concussion is from the Letty group in Buffalo with the Buffalo Concussion Treadmill Test or Bike Test. And this is a low-level exercise test where it's done walking on a treadmill, and people are asked to talk about the intensity of their symptoms as we monitor what their heart rate does in response to exercise. It's a modified bulky protocol, which means that typically their perceived exertion will increase at a pretty steady state along with their heart rate, which gives us an idea of where we can safely start to prescribe exercise. And how would we use that test? Well, the idea would be whatever heart rate the person got to when their symptoms started to increase, we would start the person at 80 to 90% of that heart rate and begin exercise, ideally 20 minutes a day of low impact activity that would be aerobic in nature. start with a 5-minute warm-up and then get into your 20 minutes of exercise and try to build as tolerated up to 6 days a week. And we're going to see that we're going to increase our heart rate by 5 to 10 beats per minute as we start to see that people are exercising at an intensity that feels easy for them and isn't provoking symptoms. We're going to give them the go-ahead to progress that exercise on their own. But what happens if you are working at a clinic or in a facility and you don't have access to these tests? You don't have the facilities, or maybe you don't have the time to run a Buffalo concussion treadmill or bike test, but we still have individuals that we want to safely get back to exercise. The Ledi group has come up with a formula that if you have a way for the person to track their heart rate, maybe it's an Apple Watch or some other type of smartwatch or device, they can start with the Carbonin formula to figure out their relative max heart rate of 220 minus their age, and just start with a prescription of 50% of that number. It gives them a really safe place to start that typically will be, if anything, kind of underdosing exercise to begin with for the first few days so that they have a good experience. And then the idea would be to gradually build from 50% back up to 80% of the heart rate max. Our goal, similar to the concussion treadmill test or bike test, would be to exercise for 20 minutes a day based on this formula and to build our stages gradually based on using the person's heart rate. And it's okay to remind people, and it's advised that we remind people that increasing symptoms in exercise for a short period of time does not delay their recovery. And the importance of exercise is actually that it will speed up their recovery. So our take-home points for today are that aerobic exercise helps to improve recovery times after concussion and helps to decrease symptom severity following concussion. It can be safely started after a period of relative rest of 1 to 2 days. Our gold standard is still the Buffalo concussion treadmill or bike test in terms of determining appropriate dosage, but we do have other ways to use heart rate to monitor exercise intensity if we don't have access to those tests. It's important to remind people that briefly exacerbating their symptoms will not delay their recovery, and that concussion really does require an active approach to rehabilitation. So I hope you found this helpful. Here is the link to check out more about echo concussion. And Bono and I do a much deeper dive into this topic to the tune of about a 30-minute presentation. And we'd love to see you there. Thanks.